I'm here with my 45-year-old patient with a history of angina attacks who's experiencing an angina attack right now. Pain is about 9 out of 10 on the pain scale. We've ruled out the possibility of MI, and we are now looking about maybe giving you a dose of nitroglycerin. You said you had the prescription? Awesome. Actually, you know what? Before you do that, I'm going to put on my BSI. I'm going to put on gloves because, one, I'm going to be handling your medication, and also I think we're going to do best to administer this today sublingually, which means under your tongue. So not only am I going to be touching your medication, I'm going to be putting my hands in your mouth, and so definitely better if I'm wearing gloves for that. All right, thank you. So I'm just going to confirm the name on here. Can you tell me your name?
Alicia Berry.
Perfect. And I'm going to confirm that the expiration date is 1/1/25, so this is still good.
Yeah.
Can you tell me the last time you took a dose?
A few hours ago.
A few hours ago, okay.
Yeah.
And how did you take that?
I just chewed it up.
Chewed it and
yeah.
swallowed. Okay, no problem. And unlikely, but I have to ask, any chance you've taken any Viagra or erectile dysfunction medication in the last 24 hours?
No.
No? Okay, good. All right, thank you. So at this point, I'm going to check your blood pressure. One of the other criteria for this is that you have to have a blood pressure of systolic of over 100. So we're just going to make sure that that is the case. And once we can confirm that, we can go ahead and get you all set up with a dose of this medication. Stethoscope here. Are you okay? Comfortable?
Yeah.
All right. Awesome. Your blood pressure is 128 over 83, so that's perfect. So at this point, we've decided that you have angina pain that's a 9 out of 10. You have a history of this. You have a prescription for this. I don't think you're having a heart attack.
Okay.
So I do want to administer this medicine, get you some relief for that chest pain. But I want to inform you of your patient rights before we administer this. So you have 6 patient rights. The first one is right patient.
Yes.
So we've confirmed that it's you. The second one is the right medicine, right? So nitroglycerin, it's really important. It's a vasodilator, which means that it's going to dilate, make your arteries larger. It's also going to relax your veins. And so the whole purpose of this is so that oxygen-rich blood can get to that heart tissue, because the reason you're having this discomfort is because your heart's probably not getting enough oxygen.
Okay.
So that's what the nitroglycerin is doing. The right dose, it says here that you are a 0.4 milligram dose, so that's what we're going to go with today. Right route, I know you said before that you chewed it up and swallowed it, but when I put on my gloves, I kind of explained that we're going to do this sublingually, which just means I'm going to place it under your tongue. The reason for this is just a much faster absorption for you. It's going to get you that relief sooner. You might experience a really mild headache. Some people have a little numbness or tingling under their tongue. Those go away super quickly. So we have also the right time. You're having pain, you're uncomfortable, it's the right time, and then the right documentation. So I'm going to write all this down. I'm going to write down your name, the medication you're using, the dose you're getting, the route we're taking, and the time that I deliver it. And that way, when we get you to care later, they'll know exactly what we've done so far. All right, so I'm going to check in with medical control and make sure that they're good with me giving you this medicine. So I'm going to radio in. So medical control, I have a 45-year-old patient experiencing 9 out of 10 angina pain with a history of angina pain, their own prescription for nitroglycerin, for which they have a 0.4 milligram dose. I want to administer this now. They have a blood pressure with a systolic of over 100, so they're good to go that way. They're not experiencing an MI, and so I'd love to do this sublingually. Do I have your permission to do so? Okay, they've given me permission. So I'm going to open this up. I'm going to confirm that the medicine is intact. And what I need you to do for the sublingual part is I just need you to open your mouth. We're gonna have you lift your tongue. Okay, I'm gonna place it under your tongue, and I don't want you can close your mouth, go ahead. I don't want you to chew this at all. It's actually gonna absorb pretty quickly. So we're just gonna sit here while it absorbs. You're gonna notice pretty quickly that you start to feel better because that vasodilation works right away. And then in a minute or two, I'm going to recheck your blood pressure, and then I'm going to reassess you every 5 minutes. And after this is absorbed, we'll head to the ambulance so that we can get you to the hospital and make sure everything's all right in there. Okay?
Okay.
All right, thanks.